So genetic testing is a means to find the primary defect in a genetic disease like primary hyperoxaluria. So we usually use a DNA sequencing approaches, and from that we can find which gene seems to have a DNA problem in it, or a problem in the DNA, and we can determine the exact change that has occurred in the gene. So if you use clinical methods, sometimes you can get an idea that the problem is primary hyperoxaluria, but often we can't get a definite diagnosis in that way. This is where clinical or genetic testing can be helpful. From the genetic testing, we can determine exactly which gene is involved, the one causing PH1 or 2 or 3, and the defect that we find in the DNA. And this is considered a definitive diagnosis of the disease, and that means that as a patient, you're able to then enroll in a clinical trial or start a treatment that requires a definite diagnosis of PH to be enrolled. So the OHF has a lot of information on their website about different providers of genetic testing. Clinical testing for pH is now quite widely available. I think you can also ask your nephrologist, or if it's your child, their pediatrician or the pediatric nephrologist. They should also be able to find a provider for clinical testing. Yeah, the genetic testing is going to be helpful if it's a monogenic disease. So that's a disease where defects in one gene are causing this disorder. So that will be the typical PH1, PH2, or PH3, because we're looking for a genetic change that's associated with the disease. In other cases where the disease doesn't have a genetic basis, but like enteric pH, then we won't find an underlying genetic disease. And so the genetic testing is useful where a monogenic disease is suspected. But it may be sometimes, we don't find the cause of the disease every time we do genetic testing. And that's sometimes because the disease is more complicated than just a single genetic change, or maybe it doesn't have a genetic change at all. But nevertheless, the genetic testing may be helpful to make it less likely that there's a genetic form of the disease.